child to kind of help slow the process down. So I had that, and then, I was just on a lot of medication. And so from then on, I was pretty healthy overall. I was living, going to school, living life as a normal kid. I was obviously weaker than most children. I had a lot of medical things. I had regular checkups. And then, when I started to get to the age of 8 or 9, my health started deteriorating. I couldn't really do much as a child. I had to be really careful of what I was doing, where I was going. And then at the age of 10, I got really, really sick. And so I had something called spontaneous bacterial peritonitis. So that's a complication that can come from when your liver is failing. And so I was going into cirrhosis already. So I, was rushed to the hospital. They had to take a sample. My stomach was really big because I had so much fluid buildup and things were going pretty badly. So after, that episode, I was put on the transplant waiting list. So in the US, what happens is there's a waiting list, and it's done by how severe, your diseases or how much time you have. And there's certain stipulations. For example, if you are getting a new liver or in need of a new liver because, you had alcoholism in the past, then you have to be completely alcohol free for certain years, just so you're able to be eligible to be put on the list to get a new liver. Luckily, because I was a child, I think I had higher preference, but even so, I was put on the list in March of 2006. So it, took a while for me to be put on the list. And even then, it's not instant. It takes a really long time to find a donor. So we were looking into options of living donor and things like that. But unfortunately, my dad wasn't a match and my mom was only partial match. So we didn't want to take the risk of the organ failing in my mom. And so we started reaching out to other family members and, nothing worked out. A few of our other family members had gotten blood tests and nothing really worked out. And so then we just started putting ads in newspapers and just seeing if someone would be willing to be a donor. But no one really reached out and we didn't really have much success with that. So basically we were just left waiting. And so, it was May now, 2006, so 2 months later, and I was completely bedbound. I couldn't move. I was, pulled out of school months before. I hadn't really done anything. I was just sitting at home all day, wasn't eating, was on 24-hour IV support. And so I knew that I didn't have much time, and I think my parents knew as well. Luckily, on the night of the 26th or 27th of May, we received a phone call from our doctor saying that there is a potential donor, deceased donor available. And so, once you get that phone call, it's just the first step. You still have to make sure that you're a match and undergo all the testing. So where I was getting my transplant and all my follow-up was a 3-hour drive away from my home. So we packed up the car and went and drove 3 hours in the middle of the night to go to the hospital. And then once we got there, luckily everything was good and it was a match. And I was able to get a full donor, so a full liver instead of just a partial one. So I was very lucky, and it was a child liver as well, so it fit in my body perfectly. And then after that, I had the surgery, and then after that, I was in a lot of pain, and so we thought maybe there was a complication. So about 24 to 48 hours after my surgery, they took me back into surgery because I was not doing well. Luckily, everything turned out okay. They said that it was just some minor, pain that I was having and that it would get better with time. So after that, I was in the hospital for, I think, 28 to 30 days, recovering. And I had, one bout of rejection throughout that entire time. And so I was put on steroids and just making sure that my body was going to accept the liver. So I was there for 30 days. And then I was sent home in the beginning of July, end of June. And then when I was home, it was a pretty speedy recovery process. I think because I was a child, I was able to recover at a faster rate than most children. And also I was very eager to get back into school and meeting my friends and everything, just because I had been out of it for so long. I hadn't seen anyone in months. And so, after that, it was such a speedy recovery for me. I don't remember even the recovery process. So I started school again. I started, playing sports and being interactive. And I wasn't any different. I was on a very low dose of immunosuppressant. So I didn't really feel any different from any other kid. And then when I finally went to college at the age of 18, I was introduced to this organ transplant group called Life Source and Donate Life America, which is kind of similar to MOHAN Foundation in India. So through my dad also, my dad has been very active in that group because he is a transplant surgeon as well. So when I was 18, they reached out to me to help them with some promotional materials. And so that's when I started working with them. And when I was in college, I went to them at least once a month. We did fundraisers, we did volunteer activities, we did promotional activities. And so I've been very involved with it since the age of 18. And I've, been very active about my story on social media and just amongst my friends. And so, I've had a lot of people come up to me saying that they became an organ donor just because they heard my story, because you can't tell that I've had any liver transplant until you know me, and people are shocked to find out. And I think that goes for most transplant patients. You can't really tell that they've had a transplant or something, after the transplant and after the recovery period, because we look just the same as any other person. So when I was graduating college, I decided that I wanted to pursue medicine just because I felt like I could do a lot in medicine, and I was really interested in medicine. So about 2 years after college, I decided to go to medical school. When I joined medical school, I, again, just got more and more involved in organ donation, and especially within the States, just promoting organ donation in medical college and medical school. We were able to add an organ donation curriculum to our school. So then, other future doctors are aware of what it takes to be an organ donor, how you become an organ donor. Because in the United States, in order to become an organ donor, you just have to mark it on your license. So whenever you go for your driving license test, all you have to do is mark it. And then, if it's your end of life, they look at your license and they see that you're an organ donor. And so that helps a lot. So, just advocating and promoting informational, educational aspects of becoming an organ donor, because even in our medical colleges here, you would think that that's something that was talked about, but it's not. And I think that that's something that all doctors need to be aware of. And unless you go into surgery or unless you go into transplantation, you don't know what that means, and you don't know the need for it. Even in America, we're at a dire need for it. And COVID made it 10 times worse because, they are still discovering if they can transplant COVID patients or past COVID patients, and some people still here, they don't want anyone that has had COVID in the past to be their donor, or they don't want someone that has had the vaccine because they're worried about the effects of the vaccine. So yeah, COVID has made it very tough. And I think actually just about a month ago, my dad did his first transplant with a COVID infected patient. So it's something that they're just starting now, but still, that only increased the need for organ donors and organs, and a lot of people are still in need. So that's kind of what I focused on going into medical school, is just really promoting it within the medical community. And then now I'm in my final year of medical school, and I'm going just into general medicine with maybe a focus on hepatology. So I'll be actually treating patients post-transplant and pre-transplant, just to make sure that they're healthy and on the right track and managing their medication. So that's kind of what I'm interested in, especially for liver. I plan on doing that on the liver side, just because I had a liver. So it makes more sense. And I feel like I can be a really valuable asset. But besides that, I go to all these transplant meetings in the US, and luckily I was able to get connected to Dr. Shroff pretty early. And so meeting the MOHAN Foundation crew and just learning everything about what you guys do, I hope to, be able to contribute more and more. And, as of right now, I'm a completely healthy person. And I tell the doctors that I had a liver transplant, or I tell people at my hospital that I'm working at that I had a liver transplant, and they're shocked. they can't believe it. And so, I'm getting married in May also. So that's really exciting. And, in the US, everyone is very supportive, of past medical problems, and no one really mentions everything. I think the only thing is, having kids, but, luckily for me, I'm still able to have children. And so, yeah, I mean, I haven't had any issues with it going forward, and I'm able to study just as a normal kid and do everything. And luckily, my fiance and his family are very supportive as well. And hopefully I've changed a lot of attitudes within their family as well. They're not aware of it. So it just comes by word of mouth and by spread. And now his entire family knows my story. So they go out and tell their friends and their other family members. And so it makes a really big difference, because if you just know one person that has benefited, then it can just expand and expand and expand. So yeah, that's kind of my story.
Wow.
Yeah. Jay, if there's anything I missed, please let me know.
Yes. So, Karishma, this is indeed very empowering. And yes, I mean, the shock factor is always there when they look at you. No one can make out that you're a liver transplant recipient. And trust me, that leaves an impact. It sets you thinking, oh, this is so beautiful. This is such a wonderful thing. So, can you tell us a bit about, do you take any precautions? How do you manage your medications? Because there are a lot of liver recipients over here. So just to draw a parallel as to how, what is the post-transplant advice for people out there in the US vis-a-vis, over here?
Yeah, so in the US, first of all, it's very transplant dependent. So whether you had kidney, whether you had pancreas, whether you had liver, whether you had heart, it's very transplant dependent, obviously, because you need to treat the exact organ rejection. So for liver, what I know is that there's 2 stages after your transplant. There's the induction phase, and then there's the maintenance phase. So the induction phase is a lot stronger because you're really trying to fight any sort of response that your body has to the new organ, because it's a foreign organ putting in your body. So that's going to be a lot stronger. Most of the times you're on some sort of a steroid, and then you're also on, your other immunosuppressive drugs. So that doesn't last a long time. It really just depends on your body. It depends on your age, your body, if it was a family member that donated, if it was a completely random person. So that's kind of how they determine it. And then after, you're just on the maintenance phase. So you're just trying to keep your levels at a stage where your immune response is suppressed enough to not bring up a bout of rejection. So again, that really is dependent on person. Like for me, I'm extremely lucky. I'm just on 1 pill, and I'm on a very low dose. So I just take 1 pill, 1 milligram morning, evening of it's called tacrolimus or and that's it. But, I know some people are on 2 medications or 3 medications, and it really just depends on how your body is responding. Thankfully for me, I was a child. And I think that as children, you just have more resilience, and your body is able to adapt as you're growing. So, I think as an adult, it's much harder because your body has been used to you for so many years already that any foreign thing, it'll just immediately attack it. So, yeah, most people are just on a low dose of suppression, but it can change with time. They even say that, after you have kids, or when you're getting older, or, you have any other medical problems that come up, it can change because our bodies are so reactive to any sort of change.
So you did mention, so it's very heartening to know that you're about to get married. Congratulations, Karishma. Over here, to be very honest, it's always a challenge. Somehow, it carries a lot of stigma around, oh, if somebody's had a transplant, so pata nahi life kaise hoga, how the life will be. We didn't sign up for something like this. So it's very difficult. It is a struggle. It's a challenge to find, at least through the arranged marriage route, to find someone who can understand you and go with you. But yeah, if you're one of the few who can find an understanding partner, who decides to walk your journey with you, then of course it makes a lot of difference. But I can actually count on my fingers how many people are like that. So happy to know that. Congratulations. So you did mention that your in-laws didn't know much about it, or two would-be in-laws, they didn't know much about it. So what were their fears? What were their concerns? Could you share a bit? And how did you manage to convince them?
Yeah, so actually my in-laws, they're not in medicine at all, and so they didn't know anything about it. And luckily my soon-to-be husband, he is in the medical field, and so I think that that's one of the main reasons that, it wasn't as difficult for me, is because he knows aspects of the medical field and understands that, certain things happen. But also I think in the US, like, medical problems aren't taboo. It's everyone has something, whether it's, being overweight or having diabetes or a high blood pressure, someone has something. Medical problems, I think, are standard here. And, going to the doctor or having a doctor, going to checkups is very normal here. It's not that there's something wrong with you. It's just a part of the daily life because it's so normal here. But when my in-laws first heard about this, I think that they were very scared, and they started Googling a lot of different things. And so that brought a lot of confusion. And, my mother-in-law was asking a lot of questions and wasn't sure if, if we're able to have kids and things like that. But luckily, I think it just takes a simple conversation. And thankfully, my soon-to-be in-laws and family, they're very understanding. And I think that, because medical problems are so common here, everyone understands that it's not a limitation. It's just something that we have to learn and adapt to. And, I haven't had a problem in so many years. And I have taken a very active role in my recovery and also in my management. Like, I follow up with all my appointments. I know exactly what I need to do in order to remain healthy. So I'm very independent when it comes to taking care of myself. And I know it, because it's also because I'm in the medical field. I know when something is wrong or when something's not. So I'm pretty aware, but I think just having a conversation was all that it took. But also, like, I know in India, people aren't as receptive or they're not open-minded. And so thankfully here, I did have that in a family and I had a lot of support. And it's just a cultural difference. It's very sad, in India, it's not the same, but hopefully, with more education, it'll come around. But yeah, it was initially, I think it was a little scary, but it got better just with some conversation, some understanding, and some time.
That's so lovely. That's so wonderful. Okay. You did say briefly, Karishma, that you had placed a few ads when your parents were looking out for someone in the relations, and that didn't work out. Then you all had placed a few ads. So in India, let me share with you that it's not legal to place ads, so we follow that system. So however, we do know that in US, one can place ads for a donor. So
Yeah.
can you just share a little bit on how that works?
Yeah, so this was in 2006. So, social media wasn't as, it wasn't around at that point as much as it is now. And so, we had just set up a simple website. I think it was like Karishma Mistry organ or something like that. Just, asking if anyone was interested or, would be willing to give an organ or, would be willing to be a donor. And that's kind of all, we really did. And just through word of mouth, we were just spreading it. And, we were sharing our website with anyone and everyone that we could, and, asking around and putting, promotional insight there. But I know, nowadays, I do know, because I've seen this work a few times, is that people just post on their social media account in need of an organ donor. And I know that in the US, it has worked multiple times, because a lot of the times that I would see it and then I would share it. And I think in the US, I myself know or 2 or 3 people that just donated out of the goodwill of their heart. They didn't know the other person or anything like that. It's mainly kidney that I've seen. I haven't seen anyone willingly donate part of their liver, but I have seen people willingly donate a kidney to an unknown person just because they want to. But I think that altruistic nature is more common in the US also, just because, people want to do more And it's like a good nature thing here. But or even in the US, I think everyone knows someone that either has kidney failure, their parents had kidney failure, their grandparents had kidney failure. And so I've come across a few people also that are waiting, or they don't know what to do, and things like that. So it's more common here. And thankfully, through the help of social media, and there's all these pages like need kidney, need liver, things like that. And so it's really changed now, in the US at least.
Yeah, thanks for sharing that, Karishma. So Usha wants to ask you, so let me just read. Hi, Karishma, absolutely inspiring story. Congratulations, God bless. So Usha is asking you as to, during the pandemic, did you face any issues? What about the vaccines?
Yeah, so during the pandemic, I think that everyone initially was very scared, especially if you're immunosuppressed and you're a transplant patient. Luckily, for me, I wasn't being more careful, but it wasn't anything that I was isolated in a room and didn't go out or anything. I was just in home. So I was just with my parents, and I would go out here and there, but it wasn't anything too extreme. I did not get COVID during the pandemic. However, I did get COVID in January of 2022. So I did have COVID at that time, but it was just like having a cold or flu symptoms. So, I just was very tired. I had no problem breathing or anything, thank God. I just had fever, very tired, sore body, nose and breathing a little bit. It was congested. But other than that, I was completely fine. And I know other transplant patients here who have gotten COVID, and they've, been able to recover pretty fine, just by staying at home. Although I do know other people that have had to go into the hospital and have deteriorated. So again, it just really depends on your body. Some people just had transplants a year ago and then they got COVID. And so that's a bit more serious, and that, they do have to. And actually, I was doing a lot of research, and in liver transplant patients specifically, some people say that there's no difference in the mortality rate. So, there's no difference if you had a liver transplant or if you didn't. And if you catch COVID, the chances of you dying from it. In the US, at least, from the studies that have been done, a lot of the studies say that there's no difference. There might be symptom differences, like you might end up getting sicker or have a longer recovery time. But the paper that I was reading yesterday, the research that has been done, they said that there's no difference in the death toll between the two. Yeah. So when the vaccines first came out, my doctor told me to get it. They said that it would be very beneficial. So I got the vaccine when it came out. I didn't have any symptoms. And, because we're immunosuppressed, the vaccine, might not have as strong of a response because your immune system isn't able to create that. So I had the first 2 doses, and then I got a 3rd dose about 6 months later. And then I got a 4th dose, I think 6 months back. So I've had 4 doses of vaccine, and, in immunosuppressed patients, because it doesn't create that immune response, you have to keep getting the vaccine. They haven't told me to get a 5th. And honestly, because I had COVID and it wasn't that bad, and now COVID's kind of become a little bit more normal, I don't think that that's something that my doctors are worried about. And even if I do get it again, I don't think that it's anything to be concerned about. Yeah, so that's kind of.
Yeah. So yeah, COVID was scary, I think, all across the world. Over here, we were also learning, dealing, coping with, how the turnout would be. I think most of us were cooped up inside the houses, especially in the year and a half or so. And there was a point where I think all of us were just too sick and tired of staying at home and just started. Anyway, so my request to those who are watching us live would be to please put in your queries in the chat box. Achal, I'll need your help in reading them out over here. And we have a few more queries that have come up. Agarwalji wants to know. So Agarwalji is a liver transplant recipient himself. He's saying, hi, Karishma, your narration about liver transplant and the journey, thereafter is very brave, inspiring, and thought-provoking. I wish to know your views on, and then I think this chat is over. So Agarwalji, do you want to unmute yourself and ask Karishma yourself? Please let us, okay, here on how to maintain healthy liver and healthy time. Okay, he's a liver transplant recipient of more than 10 years himself, and he wants to know as to how do you, I think, keep yourself healthy and what is it that you do?
Yeah, so I think it's not any different than a normal person, besides the fact that you have to make sure that you're taking your medication. As long as you're consistent with your medication and you're living a healthy lifestyle, which means, getting exercise, eating well, having the right diet. Other than that, there's no other formal things to do that you need to take extra care of yourself. It's really just the medication aspect. Besides the medication aspect, just make sure you're doing everything, that your doctor recommends, and also just that any other person would do to maintain a healthy lifestyle. So eating well, exercising well, and just making sure that you're taking care of yourself in any normal way along with your medications. But there's nothing you need to be worried about or doing extra. It's just the medication aspect, really. Otherwise, we're completely normal people. Like I haven't done anything extra in the past 18 years. I just make sure that I'm, taking care of myself and sleeping, eating, and exercising a few days a week.
Thanks for sharing that with us. Mr. Agarwal is 72 now. He's saying he wants to make it to triple digits. And he's excited looking at you as a role model. So that's lovely. Do you want to say something?
You will make it. Yeah, you will make it to triple digits. I hope to make triple digits also, but you're taking an active role in your health, so I'm sure you will. Thank you.
So, okay, there's one more question from Dr. Hemant Patil, but before I go on to that, I wanted to ask you, Karishma, can you also share? So there are a lot of volunteers who have joined in as well. Some of them are MOHAN Foundation staff as well. So we would also like an insight on how is it that you are engaged with spreading the word. What is it that volunteers over there do, and how is it that they can engage? Because some of them are extremely passionate and motivated about raising awareness, but what is it that's happening over there? So we can also try and do that over here.
Yeah, so I think that here what we do is we have a lot of events. So every year there's this annual event called Donate Life Day. That's where they have speakers come, and that's an opportunity for all the volunteers to kind of create their passion for it. So seeing other donors, other recipients that have been able to achieve something because of the volunteers or the support that they've gotten from the organization. So that's yearly. And then I think another thing that volunteers do here is whenever there's a public event, they always have like a stand or some people there to talk about organ donation. So when I was in college, I remember that Children's Hospital that was across the street from me was having an event. And so we just went there to talk about organ donation and just spread the word. But also now I think, it's kind of like what you guys are doing here today, just having these Zoom meetings or these Zoom events and just having people become aware, sharing on social media. Social media has become huge, and just having people talk about their story. And then, there's youth groups here as well in the colleges. And because, medical college here is more, I think, standardized, I think people in medicine, they're able to, talk about it more. And so going to different colleges and speaking, for example, when I was in college, I went to the high schools in the area. So the people that were just turning the age of like 15, 16, 17, and they were going for their driver's license test, that's when you actually put it on your test. That's when you actually can mark organ donation or not. So I would go to different high schools and tell them, when you go for your driving test, you're going to have this question. Do you know what that means? Let me tell you what that means. Let me tell you how it matters. And so that's kind of the things that I did. And that had a huge impact because when you're 15, you don't know, you just want to get your license, you just mark whatever questions there are and you move on. So here that made a huge impact. And I think just even, I think us as recipients, we are very active in the US. And so we have our friends and our family and we all volunteer and things like that, but we share our story any chance that we get. And I'm doing something again in 2 weeks for our college, just to share my story with people that want to become doctors. So they're not yet in medical school, but they want to. So yeah, I mean, just through word of mouth, and even for volunteers, just, finding any events that you think that would be beneficial for you to be present at, and share your story. And especially, I think it starts when you're young, because I think in older people, it's a bit hard to change, the perceptions and the mentality. But I think when you're young, when you're in that age of 14, 15, 16, and you've had someone that's died from kidney failure, if you've had someone that's had some issue, like diabetes or anything like that, and knowing the complications that it can cause kidney failure, I think it's important then to say, okay, in order, this is important to do in the future, to sign up to be one of these, just in case.
Lovely, lovely. Thank you. Thanks for sharing that, Karishma. So Dr. Hemant Patil, he is, I think he's completed 5 years or 4.5 years post liver transplant. He says, "Hi Karishma ji, good to listen to your story. God is great. I have a question that due to steroids or too much of tablets, do liver transplant patients develop diabetes?"
Yeah, so unfortunately, anyone can develop diabetes, whether you're a liver transplant patient or not. But I think liver transplant patients they take a little bit better care of themselves after transplant, because that you have to. So, I don't know the statistics as to if liver transplant patients develop diabetes more than a normal person, but, out of the people that I know that are liver transplant patients, no one's diabetic. And I see diabetes so much in our population, just normal population here, just because they're not taking care of themselves. So I feel like in liver transplant patients, because we do have a little bit more awareness that we have to be healthy, I haven't seen it personally, but it can happen. It's not that it can't happen. You just, it can happen in anyone, liver transplant or not. But as long as you're doing the same thing, staying healthy and eating and exercising, you're doing everything you can.
So Karishma, what is it that you do to keep yourself fit? Of course, you're young, but your tips for others.
Yeah, I have good days and bad days. So, sometimes I'm able to go to the gym and just walk or exercise for at least 30 minutes a few times. I go at least 3 times a week. I try to go 5 to 6 times a week. But sometimes with my schedule, I'm not allowed. And luckily, I'm in a profession where I'm constantly walking. I'm constantly on my feet. I'm not at a desk sitting all day. We're very active in the hospital just because we're running around everywhere. So that also helps me a lot. Diet, I'm vegetarian, so I think that helps me as well personally, just more salads and trying to be a little bit more cautious. I do eat unhealthy from time to time, but I make sure that I'm still, exercising and taking care of myself, and then just staying true to my medication. I just make sure to take my medication in a timely manner, get my blood tests every few weeks whenever I need it, and that's it. I mean, I haven't had a problem with taking care of myself in a different way, but just any normal person, what they do.
So how often do you go for your checkups, Karishma?
So I get my checkups over the years. It's decreased. I also work in a hospital.
Yeah.
So, luckily, whenever I feel I'm not okay, I can easily just get someone to check me up. But before I was in the hospital, I was going, I would say, at least once a year in person to the doctor, but I was getting blood tests monthly just to make sure my levels were okay. And then, if I needed to go in for any external reason, I would go in. But if I was fine, then once a year. Yeah.
All right. So Mr. Agarwal wants to share that both he and his wife are very positive about life and leading a retired life in a supporting manner. He's trying to enjoy every moment. He's taking care of himself with regular tests, medicines, diet, and exercise. And so far, it's been a great journey. Mr. Agarwal, why don't you unmute yourself and share it yourself? In the meanwhile, does anyone else have any questions for Karishma? Please feel free to unmute yourself and say, Achal, if we have any questions on the chat box, you can read them out here, please. Achal, do you have any questions for Karishma? Achal is, she heads our patient support group. Yes, hi.
Abhay here.
Yes, Abhayji, boliye.
Well, I can speak a little bit. Question to Karishma. Or Karishma, I'm Abhay.
Hi.
Hi. Well, you can see me? Okay. I'm 71-year-old.
Yes, we can hear you.
A second.
Carry on, Mr. Patne. Yeah.
Well, I want to ask a question to Karishma about the diabetes. I had surgery in 1919 December. Okay, it is a swab. It was a small child, 7 years, like you.
Yeah.
His mother given me the liver part, and that boy has got the liver part from my son.
Yeah.
Okay, we are all four doing well.
Okay.
I'm in Dubai, they are in India, my son is in Dubai also.
Okay.
Well, I want to ask you a question. As you are a doctor and you have so much, maybe studied more than me, I feel like. So, diabetes, I'm not facing any problem, but I suffering nowadays after 3 years. This what do you call hernia problem, and it is a part of the liver portion level in the stomach level.
Okay.
So you heard about these things happen after the liver surgery, hernia get problems because of the muscles get loose.
Yeah, so sometimes the muscles in your stomach can get loose and then things from underneath can, protrude through the muscles. That's called a hernia, is when there's
Correct.
a little part that goes through the muscles. So, it just depends on your body and how strong your muscles are. I'm not a surgeon, so I'm not exactly sure, how to go about, they'd have to correct that if it's severe. But other than that, it's just because your muscles weren't strong. And so they were able to get through, something was able to get through the muscle to the skin, superficial area. But, I'm not exactly sure further than that, just because I'm not a surgeon.
No, okay. My experience, I just further added in that. I went to Bombay in the global hospital, and they did my hernia surgery again. Okay, they put the smash in the body, the smash,
Yeah.
But even after 6 months now, I'm not feeling comfortable with my stomach. After eating food, little bit heavy become.
Yeah.
So 1 year after surgery, it was okay. Even 2 years, it was okay. I'm comfortable walking, little bit slowly, fast walking. But now again, my stomach very tight, So I wanted to go again and show it, because in Dubai, it is not that much facility,
Sometimes,
So,
Abhayji, you have to, go see your doctor regularly for a follow-up, and when things are normal, just a blood check and sharing that with your doctor would do. But otherwise, it's advisable to go for a periodic checkup. That's something that is always advisable.
No, I go there every 3 months. I go to India and do the checkup. But last only 6 months, this is a developed new thing. Absolutely, and otherwise I'm okay. everything routine life, driving,
Kardiya.
everything is fine.
Wonderful. So
So
nice. Thank you for sharing, Mr.
Mm.
Patne. I have a few more questions. Just a minute. So Dr. Hemal from MOHAN Foundation, she has a query. She is asking you, Karishma, aren't you afraid of infection? Shouldn't you be, as a recipient, should be staying away, should be more careful about catching an infection, and you're working in the hospital right amidst all of that. So aren't you worried about that? How do you handle that?
Yeah, I mean, we are more susceptible to getting infections because we are immunosuppressed. But I, touch wood, I've been healthy, and whatever infection I have, I mean, I get sick two times a year at least, but just normal stuff, cold, flu, things like that. And that happens to everyone. I have friends that are getting more sick than I am, so as long as you're taking care of yourself, you're doing, you're on your immunosuppressions. I wear my mask in the hospital at all times. So as long as you're taking proper precautions, I feel like you can't be scared. I wanted to do this. I know that I'm more susceptible to an infection, but you also have to live your life. I fully believe that. I don't think that, we should let fear prevent us from living life or doing what we want to do. Just, obviously take precaution, wear your mask, wash your hands as frequently as you can. But infection can happen to anyone. As long as we're being careful, I feel like you should live your life and not be so scared of simple things. And most times, if you do get an infection, it's not going to be a severe one. It's mostly going to be a cold flu, at least here, in the hospital that I'm working at. We do have certain serious problems, like we have some tuberculosis patients and things like that. And if I can, I try to avoid seeing those patients. I try to have another one of my colleagues go see the patient. So I'm a little careful in that way. If it's a very serious respiratory thing, then I won't go. I will ask someone else to take it just for my own safety. And people are very willing. So, yeah.
Wow, Karishma. So
Yeah,
good to hear that.
thank you,
Yes,
Karishma. It's
Sridharji.
wonderful. I have one question.
Yes.
Not question. I learned from you 3 points for post-transplant. One is personal hygiene. Wash your hands, keep yourself clean, neat. Second message, what you are given is consult the doctors periodically, do the test what as per the suggestion.
Yes.
Then the third is take the medicines on time.
Yes.
If I missed anything more than 3, please let us know. It was a wonderful journey. I think, what you said is right. I look in this way. When I am doing the counseling, I tell the people that once you undergo transplant, it is like a new birth for you.
Yeah.
So you have to live 100 years from the date of transplant.
Yeah, I
Because we
agree.
bless for a new baby that live for 100 years. We bless the baby, right?
Yeah.
So when I am talking to any transplant recipients, I do tell this message. If I missed anything more than these 3, please let me know.
No, you got it. Perfect.
Thank you.
Thank you for
Thank you.
summarizing that, Mr. Sridhar. Very nicely put.
Thank you. Thank you. This message is
Agarwalji?
also for you.
Ah, yes.
Ah.
Thank you. Agarwalji, you wanted to add to something?
Yeah, I have got to say, sorry, 2 things here. Number 1 for Karishma. I am a 10-year plus liver recipient. But on seeing you, I am highly motivated. That because I always had a question how many more years of the good inning I can get. But on seeing you, I feel my target of 100 years is achievable.
Yeah, definitely. Yeah.
And the second thing is, I think it is a boon to the people or the, let us say MOHAN Foundation or Jayaji and all that, because you are yourself a doctor, number 1. Number 2, you are a liver recipient. So your mental and your body language and every expression, every, thinking is now directed toward this. You can do a lot of things from US for the US or even for India also to promote the organ donation. We would like to see you as a role model, as a lead person, and I will be your #1 follower.
Oh,
And whatever
so
you
nice.
want me to do, I will be your partner from India, Gurgaon. Okay?
Thank you.
No, really, probably we need to spread this message more and more. And a person of young age with a medical background and herself being a liver transplant recipient, I think it is a wonderful combination. And I would say that JIG has brought you on this meeting. I feel blessed to be a part of the meeting today, right?
Such
That
a
is
sweet
number
thing
one.
to say,
I
Mr.
would
Agarwal.
share my personal experience.
Karolji, I will add one
Easy.
more thing.
Yeah.
A boy who underwent transplant when he was age 8 or 9, he was determined to become a doctor and become a liver transplant surgeon.
Yeah.
Very good.
Now he finished his MBBS. Now he has done his MS. Now he is going for the liver transplant surgery specialty.
So
He,
God bless.
Yeah.
God bless.
this is Dr. Sanjay Sridharji. He was the first liver transplant recipient in India, I think.
yeah, Apollo Delhi. No, I didn't want to tell the name, but I'm just giving you the background.
Wow.
Very
Yeah.
good. Very
He's-
good.
Maybe we'll get him next time with Karishma.
Yeah.
Yeah.
It'll be good to have them both.
Yeah.
Now,
Thank you.
the second thing I want to share with Abhayji about the hernia issue. The similar problem arose in my case also. And about 1 year after the liver transplant, incisional hernia surgery was done, the wire mesh was put, and I've been doing perfectly fine. But in the recent years, maybe 1 or 2 years recently, I have got incisional hernia again on the other side. Earlier it was on the right-hand side, but now it has started on the left-hand side. And doctor wants me to go for the ultrasound, try to see how the internal story is. And possibly doctor advises that as long as you can manage and continue, please let us not open it up. But if required, we will open it up and put the wire mesh on the other side also. But one small issue, where the wire mesh has been put, that particular element is hurting my lower edge of the lungs a bit. That is what internally I feel. And doctor has to sort it out when I go and meet him. This is in connection with what Mr. Abhay is experiencing.
Thanks
Probably
for
a
sharing
similar
that.
problem I also had, and I am also having. After diet, after meals also, sometimes I feel heavy. And for that, I take something which is, let us say, gas not forming.
Antacid sort of.
Gastrics.
Okay.
So, like pentacid and all that, some sort of medicine I am taking in that. So it is helping me at the moment.
Thanks for sharing that, Mr.
Yeah,
Agarwal.
thank
I think this only goes, goes to show that we need to have more such meetings, more such interaction amongst the liver transplant recipients, and so that there's sharing of experiences and we learn from each other's experiences, because we keep thinking that this is only happening to me, but then you'll realize that there are others are going through something similar. And hearing them out gives us much more confidence, and that it's something that can be tied over or something. So wonderful. Okay. So thanks for sharing, Mr. Agarwal. Does anyone else have any query? Or I'm seeing Anita here. Anita, do you want to say something?
Hi, Jaya. Now, I just wanted to actually just say thanks that it's been a wonderful session. And, as you're aware, I'm a donor and the mother of a recipient. At such sessions and such courage from this wonderful young doctor give us a lot to hope for and look forward to. And I send her all my love and blessings, and keep on rising, keep on shining, my child. Just start, Thank you so much.
Thank you.
You said it, Anita. And at that note, thank you for sharing, all of you all. With that note, I would like to end this session. Thank you so much, Karishma. Please keep shining and inspire many, many, many more show them that transplant is for the tough ones, and we know, and I'll only wish that all of us hit triple digits. I'm a kidney recipient myself, as many of you all are aware. So we need more positivity around. We need to be sharing each other's experiences. So thank you so much for taking time out. And you're doing amazing work as far as organ donation, raising awareness about organ donation is concerned. We hope to keep engaging with you much more going forth. And all the very best from all of us here. And congratulations for your shadi.
Thank you. It was very nice to meet all of you. Thank you so much for joining. And hopefully I'll, be a part of this for a much longer time and help in any way I can.
Thank you. Thank you
Karishma, I have got small suggestion.
Yes.
That please write or post even through the MOHAN Foundation your positive and your tips for the transplant recipient. Okay.
I will. Yeah.
That will be great, because when you write, it is like 100 people writing. It is very, very strong message. Very, very strong message.
Yeah, I will, definitely.
Yes, Agarwal ji. So we have asked Karishma to put together her story and also share with us the tips on this. So we will definitely be circulating it amongst you all. Thank you so much for joining us. Ganesh, you can probably put off the
Thank you. Best